South of the border, the U.S. is now reporting more COVID-19 deaths than anywhere else in the world. More than 20,000 people there have died from the disease. More than 2,000 deaths were reported on Friday alone, the deadliest single day since the outbreak began. New York State remains the hardest hit part of the country. It has seen more than 8,600 deaths, and today, New York City's mayor ruled out opening schools for the rest of the academic year. But as CBC's Stephen D'Souza reports, officials say there are still signs of hope.
At a massive field hospital inside a New York City convention center, National Guard medics treat a handful of patients. As the number of hospitalizations levels off, the extra capacity this facility was built to provide hasn't been needed.
The good news is the curve of the increase is continuing to flatten. The number of hospitalizations appears to have hit an apex, and the apex appears to be a plateau.
But that silver lining still frames a grim reality. Patients continue to die at an alarming rate. 24 a day are buried in a mass grave on an island in the Bronx, long used for New Yorkers with no known next of kin. The governor says the daily death toll is leveling off at a horrific rate.
783 people, 777, 799. These are just incredible numbers, depicting incredible loss and pain.
The virus continues to take an economic toll as well. In Pittsburgh, people lined up for hours to receive boxed meals. While in Texas, families arrived overnight as a food bank in San Antonio distributed more than 1 million pounds of food to more than 6,000 families. Under pressure to reopen the economy, President Trump will announce a job-focused task force next week.
We're going to make a decision, and hopefully it's going to be the right decision. I will say this, I want to get it open as soon as we can.
But his own officials warn, without mass testing, reopening risks a second wave of infections.
That's a question that we still have. Is this the tip of the iceberg, or is this half the iceberg or 3/4 of the iceberg, what we have seen to date?
Across the country, new community surveillance efforts are popping up. This one in California tests a patient's antibodies to see if they've had the coronavirus and recovered. A key piece of information as communities look to figure out just how widespread the virus is and when it will be safe for life to resume. Stephen D'Souza, CBC News, Toronto.